Welcome back to the Practical Behavioral Care Podcast. Today we're diving into a topic that shows up far more often than most people realize, something many of us witness in others or experience ourselves, but rarely put a name to: high-functioning depression. On the outside, it often looks like someone who has everything together. They're productive, reliable, polished, the person who always gets things done. They show up for work, take care of family responsibilities, stay social, and appear completely fine. But underneath that steady exterior, there can be a quiet, persistent heaviness, sadness, exhaustion, or a sense of numbness that doesn't fully go away. And because these individuals continue to function, their pain often remains invisible. If you've ever wondered how someone who seems perfectly okay might still be struggling inside, this episode is for you. Before we go any further, a quick but important reminder: this podcast is for educational purposes only. It is not medical advice and should not replace guidance from your own licensed healthcare provider. If you're struggling with your mental health or supporting someone who is, please reach out to a qualified medical professional for personalized care. Now, high-functioning depression isn't an official clinical diagnosis, but it has become a helpful way to describe a very real experience. These are people who can meet expectations, sometimes exceeding them, while battling a steady undercurrent of emotional distress. They may carry a smile, offer support to others, and perform well professionally, yet privately feel overwhelmed, disconnected, or hopeless. The contrast between how they seem and how they feel creates confusion for others and isolation for the person experiencing it. Because when you look fine, people assume you are. There are several reasons high-functioning depression is easy to miss. For one, our society tends to assume that achievement equals emotional health. If someone is productive or successful, most people don't think to look beneath the surface. Another reason is masking. Many individuals hide their symptoms intentionally. They don't want to worry others, appear weak, or be misunderstood. So they lean into humor, perfectionism, or overworking to keep their struggles out of sight. And maybe the most heartbreaking part: many people who live with this type of depression minimize their own pain. They tell themselves they're exaggerating, that they should just get over it, or that others have it worse. That self-minimization becomes a barrier to seeking support. High-functioning depression doesn't always look dramatic. It often looks subtle and steady. Think of chronic fatigue that lingers even when someone appears full of energy to the outside world. Or activities that used to feel fulfilling now feel dull or obligatory. Workaholism can show up, not as ambition, but as a way to avoid emotional discomfort. You might also notice perfectionism, people-pleasing, and emotional numbness, where excitement and joy feel muted or completely out of reach. Irritability, low patience, and difficulty relaxing are common too. The key is consistency. These aren't signs that come and go with stress. They form a long-term pattern. If you think someone in your life might be dealing with high-functioning depression, support doesn't have to be complicated. What matters most is showing up in small, consistent ways. Instead of the usual, "How are you?" try asking deeper questions, things like, "How have you been feeling lately?" Or, "What's been hard for you these days?" When they open up, focus on listening and validating rather than trying to fix everything. Even simple acts like sharing a meal, helping with a task, or checking in regularly can help lighten the emotional load. Encourage professional support gently and respectfully. Sometimes people need reassurance that seeking help is not a sign of weakness, but a sign of care. And of course, if someone shares thoughts of self-harm or suicide, reach out to crisis hotlines like 988 or emergency services 911 right away. High-functioning depression is real, and it's often exhausting, especially because it hides behind a mask of capability. The more we understand the signs, the better we can support the people who look fine but may be hurting inside. And if you see yourself in this conversation, please know this: you're not invisible. You're not dramatic, and you're not alone. Reaching out for help is a courageous and important step. Take care of yourself, take care of each other, and remember, sometimes the smallest acts of kindness make the biggest difference. Thank you for spending this time with me today on the Practical Behavioral Care podcast. High-functioning depression is often quiet, often overlooked, and often carried by people who seem like they have it all together. By learning to recognize the signs in ourselves and in others, we create space for real conversations, real support, and real healing. If today's episode resonated with you, remember that you don't have to go through this alone. Reaching out for help is not a weakness, it's a powerful step toward feeling better. If you found this discussion helpful, please follow the show. Share it with someone who may need it, and explore more resources at Practical Behavioral Care. Calm. And as always, please remember, this podcast is for educational purposes only and should not be considered medical advice. For diagnosis, treatment, or personalized support, connect with your licensed healthcare provider. Take good care of yourself, stay compassionate with your mind, and I'll see you in the next episode.